Okay.
Turned off.
So I don't even know what the hell just happened, because my camera, I'm fairly certain, was recording. I was talking to it like it was, and it just turned itself off and turned itself back on again. So I made a video earlier, not that long ago, right, where I started talking about my day and my teddy bear sloth, right? And realized it would be better after needing to use Merv's phone to try and figure out how to pronounce whatever the gum disease I have is.
Periodontitis.
Periodontitis is what I'm being told. What?
That's the one?
Yeah, that's the one. I really got to learn how to remember the names of everything. Like, didn't even enter my head today for the dental appointment I had in Rockhampton to take my medication list, to take my list of everything just over the head, yeah? So for some backup context, I have been in need of like real major dental care for years, right? Years, okay? And obviously as I age, it's unfortunately been getting worse. And I've been to numerous dentists and specialists and whatnot, and this is where I'm at, yeah? So, today I saw I kept calling him a dentist, a doctor, a specialist, like what? Who?
Periodontist.
A periodontist, right? Man, was he interesting. Like, the first question they asked me when I went into the room was, how do you feel about the dentist? And I was like, I love going to the dentist. I find being at the dentist quite fascinating. I always love what I learn, and it's interesting. Unfortunately with me, for those of you who might be new, I love to learn, love it. Really struggle with retaining it, yeah? Makes for an actual somewhat embarrassing life, if I'm honest with myself. I cannot stand being put on the spot in front of a group of people, or even without. Like, if you put me on the spot, my brain just goes, I'm out. And I'm just left scrambling, yeah? Anyway, I've got health insurance, right? And the number one reason, pretty much, aside from when I originally got it back, was for like psychiatric care. Which now, coincidentally, I'm not even paying for gold, so I don't even have it. I'm like the second one up, but I've got extras, yeah. And other than, like I said, psychiatric care, dental was the most important thing to me, followed by like chiropractic and optical and things like that. So fast forward a bit. I had a dentist appointment on the 9th of July, and they told me what I already knew, which my gums are bad and I need to see someone. And they gave me a...
Don't even think about it.
What is she doing?
Looking up at the beach.
Oh, Happy knows how to jump and get stuff, and boy, oh boy, does she just choose when to listen and not listen. Hey, Jackson, relax. She walks past and he loses his fucking mind, right?
No.
Anyway, so I had this appointment. I knew, it's funny, I'm thinking about it now, right? Because the dentist that I went to in Gladstone had given me a quote, right, of what it would cost if they were to do what they thought was needed, Or maybe it was because today was information and that wasn't. And it left me like $328 or something out of pocket, right? And then they said, but we're also sending a referral to try to get you into an actual specialist. And not just like any gum specialist, but an actual, tell me what it is, periodontist specialist. Like someone who very much specializes in the periodontal
Teeth and gums.
Yeah, the most severe version of gum disease, okay? It's unbelievably fucked. It is bad. It is stupid. I was raised to brush my teeth every morning and night and floss and do all the wonderful things just like I imagine most people, right? I'm highly aware of what I need to do, yeah? It is interesting though, the guy I met today, he reckons that a lot of my issues, one of the first things he said was dry mouth, and I'm just like, it's constant. And he was like, I'm not surprised. Like it's so fucking dry constantly, people. For those of you asking, it's not a cigarette. It is weed. Well, it's both. It is. It's fascinating the way people change, right? Like he's going through this list of questions. This doctor, this dentist, who the fucking Chris? That's his name. Yeah, I call him by his name. Mm-hmm. Every other person in my stories, like people who, like Merv. When I first met Merv, oh my god, take a drink, woman. Solely Pepsi Max, whatever. Excuse me. When I first met Merv, right? He got a character's name just like everybody else in my life. The only people in my life, or in my stories, keeping in mind my stories are literally just me telling you about my life. So my very real life, yeah? But the only people I talk about whose real names I use, and it was a long time before I even did, and I only started doing it because of how much I was confusing myself, truth be told, are my doctors and specialists, right? So they're cool with that, obviously, because they know what I do. Like, when I'm in person with them, the camera is literally sitting there in the room between us, and we're having these conversations while it's filming me. So it's not like it's a secret, yeah? Obviously, when I moved in with Merv, and when he blew my mind and said that he was all for 24 live streaming, which we are still very much, like, that is one thing that I want and will do. It's just a matter of how and when at this point, right? It's all about funding, yeah? Like, if you'd all like to donate to me via PayPal or whatever way you can do it, feel free. Just tell me how. Content, you know. But anyway, along with today, right. See, I never have to worry when I actually turn the camera on. I'm pretty good. The only time I turn my camera on and I can barely speak to anyone is because I'm like, I'm asleep and need to go to bed, right? Anyway, so I'm having this conversation because today was actually an information center, an information, right, appointment. Like, I actually did not get any dental work at all done. I think she needs out, right? Like, I got a whole flipping, like, brochure of stuff, right? You know? Whole big brochure full of paperwork, yeah? And anyway, I got told stuff I didn't, like, I knew. Gums are bad and whatnot. I was told something that I found highly interesting because obviously by the time he'd finished telling me all of the things that needed to happen, which the first thing is a like full scale dental x-ray thing that I've been giving like the form to do it for. And I've just said to Merv actually right before picking up to do this part 2 video, because I googled it and I was like, I know for a fact I've done that, and not that long ago. And I think I actually had it done at the very local dentist, and I remember them saying they had everything in-house, and it's only hit me this evening in between the first and the second video I'm making that I have the item numbers of everything. So I've been given 2 quotes, right? That I can actually take them and then see what they say. So I'm glad I've thought of that. Back to today. He told me that aside from this x-ray, the most important thing that needs to be done, in fact, he won't actually even see me again until it's done, is that I have to have a consultation with someone who specializes in medication. Alright, so this is the thing that I was going to read out to Merv before I turned the camera on, and then decided I should just turn it on because maybe you might all find it interesting too. So, this is what I'm going to do. Alright, I'm literally just going to read this referral information out loud because I have not yet read it. Merv hasn't. And we can all just learn together. Okay, people? Oh, yeah, no. Alright, so what can this person do for me? Medication list. Compile all your medications into a comprehensive, accurate, up-to-date list, including prescription medications, non-prescription drugs, dietary supplements, and herbal remedies, including their doses, duration of therapy, and reasons for use. This can be provided in a hard copy or electronically, which you can share with other health professionals. Dental precautions. Using the comprehensive medication list, relevant dental precautions can be noted for medicines you are currently or were recently on, detailing the impact these medications may have on dental procedures and how the risks can be managed. Why do I feel like I don't think I'm going to say that word right? Periodontitis management. Periodontitis management. Advice can be provided regarding which medicines require temporary suspension prior to dental procedures, for how long, and when they should be restarted. Drug side effects. Real or potential drug side effects can be identified and whether they may be contributing to your current or future oral health symptoms. General risk of side effects and how they compare with potential drug benefit can also be discussed. This is stuff that we've been talking about for ages that I needed anyway. Like, I absolutely need someone to go through every single thing I take, and by fucking God, I said a lot.
I said that from the time I met you.
Merv's over here in the background muttering, saying, I've said that since the time I met you. Like, if I could, I want to be the best version of me. Yeah? Like, I'm doing my bestest. I have shitty days. I have bad days. I have mean days. We all know this. I film everything, alright? I film it all so that you can see that we're all uniquely different and normal in our own fucking way, right? Like, if you have bad days, jump on my freaking channel and you will see you're not the only one, right? Anyway, where are we at? Did I read drug interactions? I think so. Real or potential drug interactions between your current medicines and those the dentist may use or prescribe can be identified and managed. Did not read that.
Right.
And that's a really good one. I want to smoke my joint, but sometimes I think I ruin my videos by doing so. I think the flame just went up my fucking nose. I smell burnt nostril here.
Quite on the cards.
All right. Action plan. A collaborative action plan can be created to manage any of the drug-related problems identified or discussed to the satisfaction of all involved. I'm actually kind of excited about this now. At first I was like, holy fuck ball, the hour consultation cost $253. But reading through it is a fuckload of work because I got told by them today, because it's all via Zoom, because all of these people are located in Brisbane and I only come to Rockhampton once a month, right? And the next time they'll be in Rockhampton, I'm really hoping to be on our way to fucking Melbourne, right? Like, we've discussed it today, and I'll discuss it with you tomorrow, because I'm already too tired. But, like, how to work backwards with the dates. Alright, where are we up to? General discussion and problem solving. You can consult her to help solve any problems you are having with your medicines, or for a general discussion about your medicines so you can understand and use them to maximize their benefits and minimize their risks. How long will a consultation take? Consultations building a comprehensive medication list usually take an hour. Who is this doctor? She is a specialist clinical and drug information pharmacist who has worked with the dental profession since the 1990s. Her areas of expertise are dentistry, drug safety, drug interactions, natural health products, and perioperative. Fuck me, man. Can you tell me what that word is? If I'm reading that correctly, that one there, yeah? I'm probably not. Do you see it?
Periactive.
What? This one?
Yeah.
Periactive.
Periactive.
Well, I read that. Wait, okay. Is that different to the one that's above? Apparently not. Well, there you go. I stand incorrected. Medicines management from 2013 to 2024. She created and provided a national drug advocacy service for the Australian Dental Association called Farmer Advice. Wow, she is like really well published in over 30 peer-reviewed journal articles, 130 articles for the ADA. She's a lot of stuff going for her, right? So she's a member of the expert writing group for the Therapeutic Guidelines Oral and Dental. So we all just learnt a lot of stuff. I am finding it interesting because I guess it never entered my head all the times that we if it looks like I was touching the screen, it's because my medication alarms went off. They're literally in my phone as alarms to make sure I take them. So, yeah, I never entered my head how much work exactly would be put into it. Or maybe it did, but I don't think it ever actually entered my head that this obviously would be something that would be chargeable. But that makes sense. Anyway, currently I have two options for whatever actually needs to be done. I was going to read through them for you because technically I don't actually even know exactly what needs to be done. I just know that I've been given two options and one of them costs $2,790 and the other one costs, well, I'm confused. Where's the other one? Is that it? Oh fuck, what is happening? Trying not to break stuff, but the other one cost $7,493, right? So he did say to me at one point, right? Just trying not to confuse all the papers, which I may have done. He did say while we were like in the consultation, yeah, that, and this is obviously before the receptionist had handed me any of the paperwork, before I'd seen the prices or anything like this. So we're still in the consultation room talking, and he's talking me through everything. And he gave me all the information in regards to what is actually wrong with my mouth and the fact that it is the highest priority of getting my mouth healthy, right? And it's a long process. He has said that it's going to be a long process, but it absolutely can be done. And then he asked me if I had any questions. And I was like, yeah. I was like, you haven't mentioned the one thing that basically every single dentist, specialist dentist, what the fuck, how come I can't remember? Periodontist. I keep wanting to say podiatrist, periodontist. Anyway, I said to him, every single one of them that I've met have always said the exact same thing, yeah? And you haven't mentioned it. And I got to come around and finish the story. I was lost. I just realized. Anyway, I said, I've been told for a long time now that the 4 teeth at the bottom need to come out, right? And have implants put in. And if not all 4, then absolutely 2. But basically 4 teeth at the bottom have to come out and have implants put in. I said every single person has said that. And he didn't mention it. And he said that he didn't mention it because he thinks it's completely and utterly unnecessary. He's like, that doesn't need to happen. He's like, all we need is to get you and your mouth healthy. And like he ran through, like you wouldn't believe, this long list of things, right? And when I told him that the skin in my mouth just like peels off, layers of it, and like the last time it happened was like a week ago or so, and it was near the back of my teeth, I said so many layers of skin just peeled off, and it was red raw. And he was like really quiet. He didn't have a clue what that could be, but again, he was like, I truly think a lot of my issues come from the medication, right? So that is where I'm at with all of that. I have a lot of reading research to do. The first thing I asked once I seen the quote was do they have a payment plan? Because I spent most of my savings, and the rest of my savings is obviously all earmarked for packing our house up and going to Melbourne. Like, I knew I'd be out of pocket, but I really wasn't expecting even the first amount of, on the much, the lower level. That's right, the thing he said in the consultation, right, which was this laser procedure, right? He said, he traveled to America and he did this whole other really in-depth training course, like, to become this very, specialized in this area. And the laser machine, there's a lot of lasers happening in my life, right?
Mm-hmm.
This laser machine comes from the States, yeah? And it is high quality, super fucking expensive. Exactly like the laser being used on my tattoo removal, right? And he was like, because at first, like I said, I did not have a clue about prices or any of this stuff. I didn't know what the fuck he was on about at the point of him saying this, so it wasn't making any sense at the time, because he's saying, it might look like it's just about money, and he was literally talking about, like I said, once I got it, I was like, okay, now that makes sense. That's a fucking lot of money, like $7,500, yeah. But, and I have no idea if this is exactly right, but as it stands, from what I know, it's like this machine, yeah. Yeah, so here we go. Laser-assisted new attachment protocol. It was started in the USA in the 1990s. The LANAP protocol is the only laser treatment to receive FDA clearance for true regeneration. That's why. Because my gums have receded so far that we need to get them to, like, grow back, and it's almost that is an extremely difficult thing that I have. Now it's starting to make sense, Murph. All right? Because he's like, you don't need implants, you need to get your mouth healthy. And I was like, yeah, no, I know. Like, it's the receding of my gums that freak me out the fucking most, and it's needing my gums to regenerate and grow back, which will completely then stabilize everything else.
That's right.
Now shit's making sense. All right. It's the only laser treatment to receive FDA clearance for true regeneration. This is based on evidence that indicated that treatment led to new periodontal ligament, oh god, these are words I don't know, alveolar bone. It is relatively new in Australia. Dr. Barker, that's the dude, is one of 3 accredited specialists on the East Coast. Fuck, man. There's only 3 people in the entire East Coast of Australia who can do this. That's fascinating. I'm looking at pictures, right, people? It incorporates elements such as additional use of a laser during the debridement, and I want to ask if it's like, if he knocks me out, can it be classed as like in hospital, Then I'll just pay the damn excess. There is also a special diet and post-operative care regimen to follow. Well, I haven't read any of this yet, people. Obviously, you're learning about this right at the same time that I'm learning about this, alright? During the initial active phase, the teeth are still cleaned under local anesthetic using the same instrument as during debridement. This combination of various elements is aiming to provide the benefits of therapy and aiming for regeneration of support tissue while minimizing the risk, particularly recession of the gums, pain and sensitivity. Does it hurt? Although the procedure itself can be virtually painless, we will use a local anesthetic in the area of for your comfort. In this way, we can precisely direct the laser for treatment. Laser treatment in my mouth. Oh my God, I'm just trying to imagine that, like, right? Oh, post-procedure discomfort is typically minimal and short in duration. However, painkillers are normally prescribed just in case. What are the aims of it? Less pain, less bleeding, less sensitivity, less gum loss, less swelling, minimal downtime, faster healing, and more comfortable than conventional surgery, regeneration of supporting tissues. Conventional surgery. I want to ask them what that option is. Surgery means in hospital. In hospital means payment excess. Insurance pays everything else, right? Regeneration of supporting tissues. There's a lot of reading, people. So I won't bore you any longer because I guess if you're interested, you can look it up yourself. And I am very tired, and I've been talking for 32 and a bit minutes. On top of that, oh, my sloth, right. So anyway, as we know, puppy dog, happy, yes, still gets into everything, yeah. And we went around and we checked the whole house, right? We know we have to check to make sure everything's up and out of her way. But for the first time, ever, I completely forgot to move my sloth, right? Now, my sloth is my teddy bear that I sleep with at night. Yes, I am nearly 40, and I sleep with a teddy bear, and I'm totally cool with that. I literally take my teddy bear with me if I have to sleep in a freaking hotel or at someone's house or whatever. That is who I am, and I'm not ashamed of it, right? And so I checked in on them on the camera at one point, and they were both in the lounge looking fine. The house looked fine. I was like, yeah, everything is, going good, right? And then we pull into the driveway, and there is stuffing everywhere all over the front yard, right? And immediately I realize I haven't moved Sloth out of the way, right? Because I remember making my bed and putting him on my bed where he goes when we are home, and immediately had the feeling of knowing that I hadn't moved him up out of the way like I usually do. And I know how ridiculous this is going to sound, right? But it made my heart drop, yeah, because I love my teddy bear, right? And I was just so sad all of a sudden to see that inside of him all over the front yard. But I couldn't actually see Sloth, right? That's what I call him, Sloth, yeah. And I didn't want to go out and see him ripped to pieces immediately. And I went to my room and to put my stuff down, and I cried. Happy came in and she just jumped up on the bed and she wanted all this love and attention and she wanted tummy rubs and I knew not to tell her off or do anything because, you know, she's not going to know. She doesn't understand. And I did give her a tummy rub and that, but, you know, I was talking to her and asking her why. Why did she have to do that? And I was crying because I was sad. And I look out the window and I can see Merv, right? And he's holding Sloth and I'm noticing him picking up pieces of the insides and then putting it back into Sloth, right? And that's when I realized, okay, Happy has gotten to him, evidently, but hasn't pulled him apart into like shreds. That was salvageable, yeah? And that sort of, you know, lifted my heart a little bit because I could see Merv, so I thought I'm going to go out and start picking it up too. And Merv came in and he fixed Sloth, right? So he's got some battle scars, as Merv calls it, right? But battle scars are all good. We believe, or Merv believes, right, that Happy was going for the eyes, right? They're very chewed. And that once you got the eyes off him, right, where would have his eyes been? Here and here, I reckon?
Yeah.
About there and there, whatever.
Yeah, right.
Once she got the eyes off him, like Merv's scenario was, the way Merv explained it to me was like she probably got the eyes off, because that's what she likes, you know, hard stuff, and then would have thrown it up and down in the air and whatever, and that's how the insides came out. But unbelievably grateful of Merv, as I'm sure you can all imagine. I'm like so I'm so happy. Like, I know it is just a silly teddy bear, right? It costs $10 it came out, right? But I was with my sister and my niece and my nephew, and it's silly, but I don't have lots of really good memories with them, and I don't have a relationship with them that I want. Like, I love my sister and my niece and nephew to absolute pieces. Like, I truly do, and I would love more than anything in the world to have a close relationship with them. But as my mum said yesterday, that's just not gonna happen. But that's another story that I will tell at another time, because I'm at 38.5 minutes. I'm exhausted. If you're still here, you're incredible. And that's me for now. Good night, everyone.